This episode of Silicon Harbor Radio is brought to you by SendPro from Pitney Bowes. SendPro has 3 times the features of Stamps.com at 1/3 the price. Visit pb.com/techlife to learn more and try it free for 90 days. After that, you'll get SendPro for only $5 per month. That's pb.com/techlife.
Welcome to the Tech Life with Rich Conte, bringing you stories from the front lines of the tech industry and the insider's perspective on starting, growing, or thriving in a technology venture.
Welcome to another episode of Silicon Harbor Radio, brought to you by the Tech Life podcast and Silicon Harbor Magazine. I'm your host, Rich Conte. Each episode, we take you inside Charleston's rapidly growing tech and startup community and give a voice to the local entrepreneurs and other contributors driving that growth. Innovation and technology are the lifeblood of the entrepreneurial community, but their impact extends past the common tropes of the small tech startup trying to disrupt traditional industries. A few episodes back, we spoke with Steve McLaughlin of Blackbaud about the challenges of innovating inside a larger, more established technology company. We'll hear some of those challenges echoed today as we talk with a few individuals working within the Medical University of South Carolina who have banded together as idea wranglers to leverage innovation and technology to help that institution better achieve its mission. Our guests on this episode of Silicon Harbor Radio, brought to you by the Tech Life podcast and Silicon Harbor Magazine, are Beju Shah, Jonathan Yantis, and Megan Fink. They are founders of the MUSC Innovators Group. Well, welcome to the show, guys.
Thanks for having us.
Yeah.
Thanks.
Can you start by telling us a bit about the MUSC Innovators Group, what your mission is, and how the group was formed?
Well, our mission is really to accelerate ideas at MUSC and have a seat at the larger table and be more part of the Charleston community.
I'll tell you a little bit how we formed. This is Jonathan. Beju and I met when he was giving a presentation to a bunch of tech people here on campus, and he had basically delivered 6 applications in 12 months, and I knew right away this is someone I needed to know just because the pace that he was developing at. And so ever since we met, we basically decided we need to meet more people like this. There's a lot more people on campus. It's a large organization and got over 12,000 employees. And so kind of from there, we decided we needed to surround ourselves with more like-minded people and really build momentum around having an impact at MUSC.
Yeah, and just to add to Jonathan's collision theory, I like to call it, I think this is very important in healthcare because just talking to Jonathan and Megan and a few other like-minded folks, there's a lot of systems in healthcare that are either very slow, antiquated, also some systems that are actually broken or could do with a lot of improvement. And so as a pharmacist, one of the things I've learned along the way in my healthcare journey is there's a lot of times where we can bridge some of these gaps. Whereas sometimes with a physician and a nurse to take care of patients in the hospital or in technology and kind of translating that level of communication, that level of innovation to improve patient care and to improve and enhance the use of technology with patient care. So that was very important, sort of a collision with Jonathan at that very early stage.
Yeah, for many listeners, the word innovation is probably most closely associated with technology companies. What role does innovation play in a research institution such as MUSC?
Innovation at MUSC does encompass a lot of technology. I think technology touches almost everything these days and anything that's changing in our world. But what would be different, I think, than most technology companies, there's a lot of hardware type startups, medical equipment, there's breakthroughs in labs and things like that where people come up with new treatments and ways to store tissue samples. And so it is technology focused, but it's also just breakthroughs in the medical space. And so we see a lot of that on campus. We have a large research institution.
And with that comes a huge knowledge base, as Jonathan was talking about. And our group is really just trying to connect some of the individuals together, wannabe entrepreneurs, people that are doing really cool things, but might not know that there's somebody else doing something similar or that is looking for a researcher just like them. So our group, we're hoping to really make those connections through this social space, hopefully help bring some of those ideas into something of value. Because there's a lot going on, and sometimes in a large organization, especially in an academic medical center, it can be quite complex, and communication is not always the best. So that is a challenge and a barrier for us, and we're hoping to maybe break through some of those barriers through this connection group.
And a lot of the challenges are very similar, whether you're doing a piece of hardware or you're developing a piece of software or something like that. A lot of the challenges people face within the organization, how to market their ideas and how to communicate and things like that, are very similar experiences. And a lot of times people can feel alone. There's a lot of silos in a large organization, and they think, they're going up it alone and they've never done this before. But there's actually a lot of people here that are doing very similar things. And so that's kind of why we formed this group, is to have people share and constructive criticism and be able to learn from each other and figure out how to take that next step.
That's a good point, Jonathan. Going back to your question with research and being an academic learning institution, we are a learning organization. So we have residents, we have students that I often mentor and precept, but a lot of us do that here in general. And so how do we take that kind of concept to the next level within our peer group or within our innovator group, really? So create this ecosystem of learning and colliding as well.
Yep.
What types of formal programs does MUSC provide to support innovation in-house?
We do have an innovation center that touches the medical center and the university. So we make sure our small group is aligned with what they're doing. We bring a little bit more of a social component and consultative role. So we want to be aligned, but being small and social, we have a little bit more creative freedom to do some of the things that we want to do. But we are lucky to have some formal processes in a committee that we can run our ideas past and get the support from our leaders. It's one of our goals for the next couple years as well.
And I'd say we have great leadership at the top on innovation. They understand how important it is. Our CIO, Mike Caputo, within our department, he's been extremely supportive of us and our efforts. I think a lot of the problem comes with the in-between space. So, I think our group is more bottom-up. We're trying to be more organic. We get together with the people that are actually trying to innovate and make a difference and somehow meet in the middle there. But we do have great leadership up top. Problems kind of arise, and it's such a large organization, and it's so siloed in many ways that it's a lot of layers in between where it hasn't quite reached there yet. It's coming from the bottom up, and it's coming from the top down. We do have a tech transfer program here, and the tech transfer program basically allows you, if you're an inventor of a technology, whether you write software or you invent a breakthrough technology, they'll work with you to commercialize that in either innovation or a product or whatever it is, and then you get a cut of the proceeds, and then MUSC gets a cut of the proceeds, and it's a very mutually beneficial relationship to where they help you take things from breakthrough to commercialization, and that's actually happened quite a bit here.
And they're also a big part of the Charleston Inventor Association here in our community. Dr. Call, who is also one of our members of that group, but I think it does create this sort of pipeline for recognition as well from our internal sort of folks that are doing great things, and then also encourages that momentum to really spark some ideas and take action on those ideas, like Jonathan mentioned. So it's a really great group of folks that help with that.
Can you each share a little bit about your background and some of the experiences that sparked your passion for entrepreneurship?
My background is network engineering and computer science, but I've become much more of a software developer, and I'd just say I'm one of those people that has 50 times more ideas than I can ever implement. And so I decided a couple of years ago I wanted to have a much larger impact, and I wanted to do it at this organization because I feel like it serves our community, and there's a lot of opportunities here with things like tech transfer and things like that may not be available in the corporate world. And I really, while there are challenges at a large organization versus maybe a startup and like that, there's also many advantages. And so it really all started with my motivation to have a much bigger impact and figure out one way or another to do it here.
I like the fact that you've got these cross-translational skills and from different industries. So my background is also similar. It's from the IT domain, and then working into healthcare as a pharmacist, and being able to then merge those domains. And I currently work in our informatics, clinical informatics world. So really implementing systems that are optimized for big hospitals and ensure patients are safe and have effective quality of care. And translating those domains from one to the other are pretty much crucial in that. And so I've become pretty much an interpreter of sorts. And I think innovation requires that type of mindset in some ways. And so that's something I've been really happy to get involved in with Megan, Jonathan, and Mike's group, and keep pushing towards how do you use technology to improve patient care. Ultimately, that's one of my oaths as a pharmacist as well, incidentally. So,
my passion for innovation started when I was in elementary school, and I had the privilege of being in a small group that won a national inventors competition and got to go to DC with this whole to-do, and as a young kid thought that was just the coolest. So I've always had an interest, a passion for inventors and innovation. My full-time job is as a communicator. I'm the storyteller. I like to shed some light and position initiatives in an interesting, compelling way that can drive action, that can raise awareness. And that's what I hope to do in this group, of telling the story of our group and the great things that Beju and Jonathan are doing and our leadership are doing, but using the communication and marketing skills to just move things in the pipeline.
We'll have more with Beju, Jonathan, and Megan in a moment, but I'd like to take a minute to thank Cenpro from Pitney Bowes for sponsoring this interview. Most listeners are no doubt aware of Pitney Bowes as a long-established and respected brand, and also aware of the threat of disruption they faced with the emergence of internet-based solutions like Stamps.com. However, unlike some other companies, Pitney Bowes is doing a remarkable job of heading off that threat and innovating around their business model and portfolio with Cenpro. Cenpro lets you print stamps right from your computer, saving time and money with no special equipment, just like Stamps.com, but Pitney Bowes is taking the self-service postage model even further. Cenpro lets you compare shipping rates and delivery times between the USPS and other major carriers to ensure you always get the best deal when you ship packages. Find the shipping option that fits you best, print your paid shipping labels for USPS, UPS, and more, and then track shipments, all from the same intuitive, user-friendly interface. No more waiting in line at the post office. You also save money through the special rates that Pitney Bowes has negotiated specifically for Cenpro users that help you save 3 cents per stamp or more. Pitney Bowes offers flexible payment options that allow you to mail now and pay later, making Cenpro perfect for e-commerce and internet retailers, especially startup ventures just getting off the ground. Learn more at pb.com/techlife. Sign up and you'll get Cenpro free for 90 days, along with a free 10-pound scale. When your free trial is over, you'll get Cenpro for only $5 a month, and that rate is good for the lifetime of your subscription. That's $5 a month for Cenpro versus $15.99 a month for Stamps.com. That's 3 times the features, 1/3 the price. But you can only get this deal for a limited time by going to pb.com/techlife. That's pb.com/techlife to take advantage of this incredible offer. Pitney Bowes are masters in the craft of making your business succeed, and I want to thank Cenpro for sponsoring us here at Silicon Harbor Radio. Earlier, you shared the story of how the group got started, but what was the experience of getting the group off the ground? What type of challenges did you have to overcome, and what types of early wins convinced you that this was a good investment of time and energy?
I think the biggest point that I've learned, and I think we've learned along the way, is we didn't have so many no's along the way. Mm-hmm. So that's kind of important, because while we're always waiting to seek approval from your manager, from your mentor, or whoever, sometimes it just takes a little bit of tenacity, a little bit of persistence, and to sort of get outside your box and say, let's change what's possible for the organization, for the community, and for your professional role, and say, what else can we do that can make this better? For us, I don't think we had very little resistance. In fact, there was really not a roadmap in front of us, and I think that's something we've managed to figure out on our own, and using this entrepreneurial mindset, is find a path where people are interested, people want to be part of this. It's really looking at, from that perspective, who are you speaking to, really? Who's going to be part of this? Well, it's folks like us who've kind of had these barriers along the way, and we want to share the journey together and make a little bit more out of our normal daily selves.
Getting started, it was tough because you're like, can we do this? Can we pull this off? And do we have the time? We've never done something like this before. And so there was a lot of, you bring people in and tell them about it, and they're like, yeah, that's okay. It's not much interest. It's funny, like a lot of times you just have to do something. Mm-hmm. You can't wait till it's ready or perfect. Anyone who's innovating, or you just got to come out with that first product. You got to ship it. So basically, we just had to pull it off, grow it from there, and that was the best step I think we ever made, was to just go ahead and set the date, and we're going to make this happen. And it's really taken off from then. Yeah, I think you just really have to be passionate about something, and you just really got to get started, make it happen. And even if you're afraid it's not going to go well.
And we're grassroots, and we're still in the nascent stages. So we're learning as we go, taking feedback from our peers within the community, other folks within the organization. Feedback's been positive for the most part, but it's still early on, and we know that there's going to be more challenges ahead of us as we try to do more, or if we grow. We're just trying to learn, but the ride's been fun so far.
How do you think the challenges or barriers to innovation you experience at an organization like MUSC relate to the challenges that other types of organizations face?
Any large organization becomes more risk averse the larger they get. I think that's good and bad, but basically overcoming that need to plan and have a plan for everything, and over planning has been, and not just saying like, we're going to experiment here, we're going to crank something out and try it out. In a startup, of course, it's like, hey, I think I've got a good idea. All right, well, show me. And by the end of the day, I want to see something. A lot of times here, it's like, well, let's plan it out and figure everything out, because we can't have a failure. And so I think a lot of time gets sucked up in planning and wanting to have a perfect launch of an idea. To me, the biggest barrier is, hey, let's just try something out and see how it looks. And if it doesn't work out, we'll trash it, and we're not going to waste any more time on it. And if it goes well, then we'll take it to the next stage, versus saying we've got to figure everything out before we get started.
And the culture is starting to change.
Sure.
Our Dr. Cole, our current president, is encouraging more innovation. Our CIO, Mike Caputo, wants us to fail early and often. Mm-hmm. So I think we have that support. Mm-hmm. That we know we can try these things, and it's okay if it's not perfect. It's okay. It's a safe space to try something new.
Yeah, but you're overcoming institutional resistance that's built up over time. And I think that's probably true of almost any large organization.
Yeah, it's the history.
Anyone who knows the innovator's dilemma. So.
And I certainly agree with these points. And I do want to sort of interject, sort of from the healthcare's perspective, we do also have this mindset in some respects for a reason. So we have a need to take care of patients, and we have a lot of barriers with regulatory issues, with HIPAA compliance, security issues. If we don't plan properly, then we come across unintended consequences for our patients, patient safety issues.
Absolutely.
So we have to have all these other pieces bearing in mind. That being said, I now probably 6 months in, I'm starting to develop these tendencies on how do you prototype, how do you pilot, perhaps that's a better word, how do you pilot some of these innovations in a smaller space that then you can translate into a larger sample size, kind of like the drug industry does. We have these phase pharmaceutical studies. You start small and you test, and then you eventually release it to the public. Even then, we're actually still testing. People are reporting side effects from medications, right? So there's always going to be issues, but I think there's a great opportunity for that mindset, even in our healthcare domain.
What technologies in particular are you most excited about, whether it represents a potential big impact in the healthcare field, or it just excites you personally, or it's got a high potential for innovation?
I'd say, this is a personal space. What really excites me right now is graph databases. And so I've been doing a lot of work with graph databases. I prototyped one product. I've got 2 different graph database programs in production now. And to me, the power and the potential of graph databases, especially across master data management or so many different spaces linking together, different drug interactions and things like that. I think there's a tremendous potential for graph databases. So I'm excited by a lot of technologies, but that technology of all the ones I've worked with is by far the most exciting.
I'd say virtual reality and AI. I just think of all the potential that I could tap into in telling a story and facilitating communication, improving mobility, and just enhancing the experience. I'm excited to see what comes out with that.
Another exciting space, I think, that we have massive opportunity here at MUSC specifically is our Apple partnership. So we have the Innovation Tech Store. our innovation station. And I think this aligns with the vision our leaders have also. Is it somewhat seems like a really cool space for clinicians, students, anyone really on campus to interact with some of our technology. And some of our technology in healthcare is moving towards emerging devices like wearable, things that patients can come to the hospital with or even be discharged and then pick up on the way after maybe perhaps refilling a prescription. They'll go to the store and pick up a wearable, and that will maybe monitor your glucose or your blood pressure. And so now we have this really granular and very real-time way to track patients on discharge and prevent readmissions or prevent all these issues we have in the traditional mode as broken systems. That's my thoughts with where we're headed. Is it's a great area to focus in on and leverage the power of our people here at MUSC to build great things for patients that in the long run improve the continuum of care of patients. And that could be using, Jonathan graphing technology tools or Megan's sort of experience and maybe the merger of the two to provide that level of innovation.
Are there other members of the group that you'd like to highlight?
Well, Laura Camacho, she is one of the co-founders as well. She couldn't be here today, but she's been an integral part leading up to this time and is a great presenter and has added real value in helping people within MUSC pitch ideas and get in touch with their inner communicator as well.
How do you see the MUSC Innovators Group continuing to evolve?
We want to help nurture more wannabe entrepreneurs from idea inception into implementation. I think we'd really be successful if a new employee comes onto campus that has a great idea and they find us. Mm-hmm. And they know that we can help them in some way, whether it's connecting them with other people who they need to talk to, finding resources, or just they want to hash some ideas out and want to get some feedback with a peer. So I think that's where we're going in terms of the future. So adding on maybe more of a consultative support role in addition to the social aspect and the networking, that would be exciting to see.
One example of that was, I had a physician a few months ago come up to me and say, hey, I've got an idea. How can I get started on it? And the idea was very simple. It was, how do you write a prescription for some steroids that patient was on? So you have to taper these doses. Mm-hmm. So it takes a little bit of algorithmic sort of approach to it. You start to decrease your dose day by day. So it's kind of laborious, just to handwrite it and kind of calculate all the doses, right? So you can easily build an app that could do it for you. I would say the first step I suggested, recommended to the physician was bring out your Excel spreadsheet. Let's kind of pilot it in a very rudimentary format. Sometimes that's all it takes is that sort of idea and taking action on it by some very basic means. But then you can build on it, going back to this iterative process and this MVP. I think this is some of the thoughts that our folks are not really aware of in our community, but how great would it be to have this awareness across the enterprise and help people achieve some small action that they would not normally have achieved. And then Jonathan had a great idea on how do you intake these folks.
We've had a lot of people come to us and they have a lot of potential and they've got some great ideas and they've made progress on them. It's one thing to have an idea, it's another to actually sit down and work on it. But a lot of times they struggle in communicating their ideas and how to pitch them to their boss or who to pitch them to internally. And a lot of our goal, and one of my personal goals, is to help these people be more successful and at least get to the next phase, maybe get all the way to a commercial product. I mean, that is really my goal. And I'm also learning from them. Teaching is the best way to learn. And I really think founding this group, I had some selfish intentions too, because I wanted to surround myself with more of these people and learn from them, and we could all learn from each other. I think that's really the goal, is to take people further.
And we talk a lot about the MUSC community, but we've talked about and we've participated in community events. And so we want to be more a part of the Charleston tech scene. I mean, it's burgeoning. It's really exciting to see Charleston become a hotspot on the map for IT. We want to be a part of that. We see the potential there. So if it's supporting people that came to our meetup and they're trying to start something new, then we go and support where we can. We're trying to maybe co-sponsor some things. So we're looking into different opportunities that it's not just about MUSC. We're a part of the community. We want to support our peers that are doing things that are innovative as well, so that if they're successful, we're all successful.
What are some of the specific things that you're doing to connect your efforts with the broader technology and entrepreneur communities in Charleston?
Last couple of meetups we've had great attendance from our outside communities, our outside partners. So, it kind of brings me to some of the connections we've already made. Mike Hartwell from Startup Grind, for example, with his colleagues, is a great group that does this sort of thing, authentically connects with entrepreneurs in the community and creates these types of collisions. We brought some of that concept into our meetups, and also from startup folks, companies such as Team Foria, LaunchPeer, and bringing these perspectives has really opened our eyes in some respects to what is out there, but not only to ourselves, but also to the community within MUSC. And kind of seeing what's outside of MUSC is sometimes a bit of a hurdle for many folks, because we truly are a big village here. We have a lot of people in our enterprise, and so making those connections has been pretty key. And I would say the one feedback we've heard from a lot of the folks from the outside is it's sometimes very hard to connect with someone from the inside, so from MUSC. And if you have an idea, how do you navigate that partnership, that relationship, and then how do you continue to inject some of this startup mindset into a big enterprise like this? I think one of the successes we've had in our last meetups is we've created these conversations where it sparked perhaps a partnership. So one of my pharmacy students actually is now doing some research for a completely brand new startup in the behavioral health space. That was a great success because that wouldn't have been ordinarily achievable opportunity without that interaction. I think another success has been some of our College of Medicine students have created a small incubator concept that was based on what some of our folks at Charleston Digital Corridor and the Harbor are doing. These conversations are sparking new ideas. We hope we can sort of accelerate and be the catalyst of some of these initiatives that are going on.
Our peers are inspiring us to imitate here at MUSC, and at the same time, we hope that we can provide maybe some resources outside of MUSC.
Well, where can listeners go to learn more about the MUSC Innovators Group?
Well, we are on Meetup, so you can look for us there, and it's the MUSC Innovators Meetup, so please come to our next event. We're having one in July. We are having one July 14th at 5:30 in the Innovation Station, which is our new tech store Beju was talking about. So we're trying to leverage the store and have more events in that space, but it is on MUSC's campus. Also, email us, shoot us an idea, or invite us to something you guys have going on at innovators-meet-up@musc.edu.
Megan Fink, Beju Shah, and Jonathan Yantis of the MUSC Innovators Group. Well, thank you for joining us today.
Thanks, Rich.
It was our pleasure.
Thanks.
Since recording the interview with Megan, Jonathan, and Beju, they have updated the date of their next meetup. They will be meeting this Thursday, July 13th at 5:30 p.m. at the Innovation Station in the MUSC Library. Look for it on meetup.com and check it out. I'm planning on being there. If you can't make it this month, look for them again in August. Also, look for a feature on them soon in Silicon Harbor Magazine. Our partners at Silicon Harbor Magazine are a great resource for keeping up with all of the events and news in the Charleston technology, creative, and entrepreneur community. Visit them at siliconharbormag.com and follow them on Twitter at SiliconHBRMAG. You can follow us at TechLifePod and also find us on Facebook. The best way to keep up with the show is to subscribe. For iTunes, visit www.siliconharborradio.com or search for Tech Life with Rich Conte or Silicon Harbor Radio. If you enjoyed the show, let us know by leaving us a rating and a review. Subscribing via RSS is as simple as visiting techlife.libsyn.com/RSS. I'm always interested in learning about different ways that podcasts are being used. Recently, I came across a venture called Family Sounds that lets you turn your family history into a podcast. They produce oral history audio documentaries by artfully crafting narratives that fit your family story through professional interviews and high-quality production. You can preserve valuable voices and memories of the people you care about most, instill the legacies of real-life heroes, and share the stories of your loved ones in the form of a podcast. To learn more, visit www.en.familysounds.net and use the promo code TechLife. That's all the time we have on this episode of Silicon Harbor Radio, brought to you by the Tech Life Podcast and Silicon Harbor Magazine. I'm your host, Rich Conte, and thanks for listening.